When you work from here, emotions just play naturally. Obesity is your genetics. Obesity is your mind. Obesity is what you can learn to overcome by understanding your own physiology. There are times where we have said, go for donor egg cycle, get the IVF done, it will be your baby. But ego, मुझे मेरा बच्चा चाहिए. PCOS or PCOD. What does it actually mean? It's polycystic ovarian syndrome or polycystic ovarian disease. One thing, there is no cure. In Mumbai, there is not a single school that I haven't attended for sex education. Before you have come down to who is your partner, practice safe sex. People that require surrogacy, it's a brilliant modality. Every woman having a baby is a burden.
Namaskaram, we have Dr. Soni, wonderful doctor. We'll ask a little bit about her to herself. Doctor, tell me a little bit about yourself.
There's nothing that you don't know.
I know everything, but for the rest of us.
Okay, I'm Dr. Anita Soni. I am an obstetrician and gynecologist and one of the founder doctors of Dr. L.H. Kiragandani Hospital. I've been practicing here in Mumbai for the last 20 odd years and the rest is history.
So doctor, what is an OBGYN? What does the job include?
Well, it includes a lot. Obstetrics and gynecology. Obstetrics is the mother along with her pregnancy, good, bad, ugly, the in utero health of the baby, and of course the culmination of the pregnancy with a healthy baby or child. And gynecology covers all aspects of women's health, basically their period, infertility, stress urinary incontinence. It covers you through your ages. So puberty, adolescence, reproductive age, menopause and postmenopause. So we actually cover the health of a woman in total.
So it's been 3 decades or more?
More.
Okay. So how does an emotion come across? Like, when it comes to, because this is a very sensitive part of life, where being a doctor, how do you handle the emotions of people, the family, and all that? How does it work?
When you work from here, emotions just play naturally. I don't think I have ever had to pretend what I have not felt. If my patient cries, there are times I break down too. If in front of a patient, like just the other day, I was upset about something and the patient saw tears rolling down my eyes. And she said, Doc, we've never seen that part of you. I said, I'm a human being. So honest to goodness, when you work from here, nothing else matters. You don't have to put up a facade in front of people because at the end of the day, you are you.
So, would you give me a small incident?
Okay, there was a time in my life where I was nobody. I was Anita Maria. I moved to Mumbai. I became Anita Soni. I started working in a private clinic, and there was this little bhajiwali who used to have a small cart, or she used to come in a little tempo where she used to keep cut, cleaned veggies, and they were a little tad more expensive than the market. I could not afford it. Every 5 rupees counted. In those days, after 8:30 p.m., she knew that she couldn't store these veggies because she didn't have a fridge as big, so she'd give me half the price. I used to buy them from her, and she had a son who was all of 18 or 20 in those days, and he called for me when I came out of the clinic and said, Doctor, आज स्वस्त आहे घेऊन जा, भरपूर भाजी आहे घेऊन जा. And that's how I led my life in those few months or years. The other day, when I was walking down the 4th floor corridor, I saw her. And I ran to her and I said, Aga bai tu kashi hai? And she started crying and I said, Kai zhala? She said, no, my son is admitted and he's not well. I spoke to her, I went into the room, I tried and pepped him up, and I tried to make a little difference in his life. I walked out and seeing that mother after 30 years of my life and tears rolling down her eyes, it hurt. I had tears in my eyes, and she said, "Tu tashit hai, tu changed nahi zali." And and I told her, I can't forget those people who helped me when I had nothing. And I owe it to them, even today, for who I am.
You also known as a tough doctor at one time. What has brought the change like now?
No, I'm still known as the tough doctor. I was not. I always was, and I will always be, because I believe in something. I believe in what is right and what is wrong. And if you have to translate that into a successful result, sometimes you have to be tough. If, for example, I had a patient who spoke the world about a normal delivery. I will do it, you don't worry, I'm in sync with you. One contraction, and the entire scene changed. She was like a woman possessed. It was like the demon had attacked her. And I said, whatever happened to all your conversations? And I told her, do me a favor, get up. She says, no, I cannot, I'm in pain. I said, this is the start of labor. It's a long way to go. Then you give me epidural. I said, if I give you epidural, so soon you'll land up with a cesarean. Please get up, walk around, go have a shower, do things which are natural and normal, and we'll see how things go. At the end of about 4.5 hours, I delivered her normally. And the next day, she gave me a tight hug and she said, thank you for being tough on me. If it was anybody else, I would have opted for a cesarean. But because you had faith in me, I have delivered normally. So I felt really like I had accomplished something. So there is a tough facade at some point where you have to present it, because you have to be tough to get the end result. And if you're sure in your mind about what you want, then...
So but you're usually not just dealing with the lady, you're dealing with the father, you're dealing with the family. So how do you explain it to the male?
The men are not difficult because they have been with you for 9 months. So I prepare them in the OPD that, look, there is this side of me. I might come across a little strong to you at that point, but I promise you I will try and make it as comfortable for your wife as possible. And I keep reassuring them that pregnancy is not a disease or an illness. It's a normal physiological change of the body, and everybody grows through it. Animal, birds, bees, it's nature made. So we have brains, so we kind of confuse ourselves over pain, and reaction to pain is very different when you're perceiving it and when you're talking about it. Having said that, it is the mothers and the mothers-in-law who kind of get very possessive, and I keep them at bay. I try and explain to them, okay, look, I am what I am, but I promise you at the end, you will not regret what I am doing for you. So please trust me for what I am doing. And if they are uncomfortable, there are a lot of people who feel, no, we can't work in sync with her. I request them to please change their doctor if they are not happy with me. Because sar bhi kat ke diya, fir bolenge ke tera kat ke diya, so it doesn't work, because this is an emergency situation and even I can't predict how things are going to go. But if you come to me with faith, I will not disappoint you.
So how easy is it to explain a female anatomy to a male? Or how difficult?
Today's men folk, I think they're more well-read than you would like them to be. It is not difficult at all. 20 years ago, it was very, very difficult. But today, they know a lot more than even a normal average Indian would know. The younger generation is so gizmo savvy that everything is there on Google. So they've read it all before they've come to you.
So they are more easy to work with.
Oh, very easy. In fact, they sometimes do more research and more work. Like I had a couple last night, one of my last patients, and they were having a tete-a-tete between the two of them. And the woman said, "What do you know? I'm going through it." And he said, "I am reading about it." And I just gave a little grin on my face and said, "All right, let's see how things go." And I said, "I thought you said we were ready for normal delivery." She says, "Yeah, I am ready, but he's the one who's denying me. He's telling me, will you be able to bear the pain?" How will I know whether I'll be able to bear the pain? I will try. So I said, so then we're going for normal delivery. Then we're not talking about it otherwise.
So, but don't you think being well read also is dangerous because the Google tells you a little more than needed? You don't want to listen to a doctor at times?
Oh yes, it is very dangerous. But then if you are strong in your, perception of things, in convincing, in talking, they're okay. I think I make big friends out of the husbands, and a lot of my family and friends are now husbands of patients I have delivered over the years.
Mm-hmm.
You've seen my birthday list. They're never ending. I have the biggest parties because most of these husbands are so cool with me. They join us for a drink, they dance, they do everything with us.
Most of your patients have become friends over the years. And,
exactly.
And I think the next generation is also now coming to you.
Oh yes. And funnily enough, the other day, somebody I delivered at, the girl was born with me at Badia Hospital. I went for her wedding. And I said, boy, am I getting old? That kind of hit me really hard. I said, I was there at her birth and she's planning a pregnancy now.
So doctor, I'll just sum the topic from this part of you. I've seen a sea change of you in the last probably 2 years or so. And it's now after COVID. And as in how you transformed yourself, you have to just add this little bit of snippet about what did you do to yourself to change your physical self.
COVID taught me a lot.
Okay.
I had a near-death experience with COVID. I was not comfortable. I was on oxygen. And I had my children who were dead scared of me and, of something happening to me. It was the first wave. Nobody knew what was going on with COVID.
Mm-hmm.
And I was admitted for nearly a very long time. Being on oxygen, being isolated, left you doing a lot of introspection. And you wanted a lot of change. I saw a lot of death around me. And one thing I was sure about was I don't want to be a liability to anybody. So I decided to take my life in my hands. And my strongest motivation today has been my husband. You've seen, Abhijit has changed from what he was to what he is.
Yes.
And I said, if he can do it, why can't I? Yes, women find it difficult, but we have 1,000 excuses for everything. I said, I'm not going to make excuses about myself. I will at least try. So if God forbid something has to happen, I know I tried my best. And post-COVID, I put on a lot of weight because of the steroids. In the first wave, that was the treatment. I decided to adopt healthy diet, healthy living, clean lifestyle, try and get as much sleep and rest for my body as possible. And yes, in the last couple of months, I found a brilliant dietitian who has helped me and is helping a lot of women across to lose weight. And there's no rocket science in it. 500 calorie deficit and, just cardio in some form, whether it's walk, dance, jive, whatever you can call it, 30 minutes a day. And I think I'm feeling a lot healthier and better.
You look different.
Oh, thank you. I'm loving the change, to be very honest.
So you gave that, this is the kind of method to give, walk,
diet. In 80-90% is your diet.
But isn't the diet different for different people?
A lot of people say a lot of things, there's a lot of myths about it, but I found one thing. Obesity is your genetics, obesity is your mind, obesity is what you can learn to overcome by understanding your own physiology.
Mm-hmm.
And the day I realized that I'm never going to be a lean human being.
Mm-hmm.
I am big, I am broad built. So I have to learn to burn fat. And the best way to do it is deprive your body of certain calories and burn what you already have. And your body starts utilizing your fat to give you energy. And I've never felt as good as I have. Because I don't know if you're aware, ankylosing spondylosis, which is an immunological problem, I have been suffering from it. There was a time where I was limping and I have gone through, hundreds of MRIs and hundreds of doctors and hundreds of treatment modalities to the extent that I felt something was in my mind because I'd get up in pain, I'd sleep in pain.
Okay.
But with the weight loss, all those pains also have decreased and my quality of life is improved.
So can you just elaborate on what is that particular condition you spoke
Ankylosing spondylosis is an autoimmune condition in which your body goes against your body and there is inflammation of all your joints.
Okay.
And every small joint of yours, because it gets inflamed, there is pain. So I lived with pain for many, many years, and because you're in pain, you don't exercise, and because you don't exercise, you put on weight, and because you are upset about the pain, feel good is food, so you tend to eat. So I learned to find out what foods didn't agree with me. I stopped those kind of particular inflammatory foods. I learned that I went to a rheumatologist, and 2 of them have been my life saviors, and I don't think I'm any worse off with the problem because a lot of my inflammation has settled and I can cope with day-to-day activity. Yes, there are days which are good and there are bad days, but within the realms of being as natural as possible, I think I'm doing okay.
So it can be contained.
It can be contained. It can't be cured because it's autoimmune. But as long as you can contain it, nothing more you would want.
Right. Doctor, it's about cervical cancer and breast cancer is something which is widely spoken. It's the poster part of it. But when it comes to mental health and all, the other subjects which is not been spoken, what do you have to say about it?
Cervical cancer today is preventable.
Okay.
Most people are, there is a lot of pharma-driven industry.
Okay.
Everybody has to understand the causes to look at treatment. So when it comes to cervical cancer, the vaccine is not required by all and sundry. You have, for women who have already been sexually active, you need to get an HPV test to see whether you already have picked it up or no, especially if you had unprotected sex and or you had multiple partners, which is not new today. Having said that, women should take the vaccine to try and prevent problems, especially the young girls before they have any kind of sexual activity. Breast cancer, a lot of it is genetic, a lot of it is hormonal. So, self-breast examination, again, fight obesity, keep your sugars under control, all these things will help prevent a cancer happening. Check for BRCA, antigen, etc., because as all of you know, that all these things can be prevented. Mental health, whether you like it or not, is a state of your mind. You know, by the time you realize it, the person already has problems. And that's where obesity, stammering, lack of self-confidence, that affects a woman not only in her day-to-day life, but professionally and personally. Mental health, women don't want to talk about because they feel like it's a taboo or it is something that is, they will be labeled. I can tell. Yes. And the other day I had somebody say, "You're telling me I'm mad? I need to see a doctor." I said, "I never even said anything like that to you." I said, maybe there's something which is out of conscious awareness. You're not aware about it, which is upsetting you. And finally, your body is a state of your mind, right? If your mind is positive, you've got your, happy hormones going high, you will be able to function in a much better way than somebody who is, under the weather, very low, simply because the mind is not being able to accept the problems that you have.
Right, but is there a way to handle your personal mental health?
Oh yes. You think I don't have breakdowns? I have. Meditation. I don't know how to do it because the minute I close my eyes, my brain goes for this patient, that work. So it is something that people say you have to develop. I will mention it as number 1, but I can't do it. I've tried many times. They said start with 3 minutes, 5 minutes. My eyes closed, either I'm gone off to sleep or I'm thinking about something else. But other than that, I have a close-knit circle of friends where I will, break down my problem. I don't have to pretend to be something I'm not. I will talk to them about it and just, letting loose or letting off the burden of something that's upsetting me, and I'm much better. I have learned to deal with my problems, but a lot of people, I suggest, please go for therapy. Go to professionals, and they are there everywhere, where you can talk to them and they will definitely help you. And there is no taboo to needing a little bit of help Because if you have a problem, you have diabetes, you have blood pressure, you go to the doctor, doctor gives you medicine, holds your hand and walks the talk. A clinical psychologist will do the same thing for you.
Okay.
Why not go? Why not take that when it is available today and there is awareness of it?
But how do they identify whom they have to go to a clinical psychologist or a psychiatrist? How do they identify that?
In case no medical therapy is required, the psychiatrists themselves suggest go for therapy. If there is medical as well as counseling required, they work in tandem with each other. So if there are unseen demons which you're not being able to deal with, if there are unsolved issues from your growing years which you haven't been able to accept, or chapters which are left open and not closed, please take whatever help you require and close them so that you'll be able to move on in life rather than get stuck there and keep on moaning and groaning about the same problem which possibly has occurred 10-20 years ago.
Mm-hmm.
And you haven't been able to solve or close that chapter or that problem of your life.
So in your growing years, who was your initiation? What was the initiation to medical and sexual health, and who was your helping hand?
I'm the daughter of a very leading gynecologist. She
Okay.
is, so in her day, she was brilliant and she definitely didn't hide anything from me, but she was a taskmaster. My best friend was my father, whom I could talk to on anything under the sun. So whether it came to sex, whether it came to alcohol, whether it came to vices, whether it came to boys.
Mm-hmm.
God bless his soul wherever he is, he was my go-to person.
Okay, so dad was also a pillar for...
Oh, he was my pillar of strength because my mom was very busy working. My father used to say he's the compounder to 2 doctors in the house, but that is in jest. He used to run his own industry, which beyond a point, when he gave up, he was at home and mom would run the show. So mom was the very dominant, very working, very career focused. Dad was the more chilled person, and me being an only child, I was the apple of his eye.
You got qualities from both of them?
I think I did. I think I did.
So that's great. Is there any field of expertise you would absolutely cherish working as a doctor? What would that be?
High risk pregnancy. High risk pregnancy. Women above 38, 39 years of age, women with multiple abortions, women with medical disorders in pregnancy, women with some kind of a problem where they haven't been able to get pregnant, women with multiple pregnancies and want to save their babies, women with obesity, women with polycystic ovaries. All of that is my forte. I have super specialized in it. I love it.
So there are answers for all of these, right?
There's an answer for every problem in the universe, Kamlksh.
So today, the ladies above 45 also can look forward to being mothers?
Yes, of course. They have to approach the doctor. They have to get the right advice and they have to accept the right advice. That is the biggest problem. See, beyond a particular age, women reach menopause or perimenopause. The quality of the eggs may not be as good as they want it to. There are times where we have said, go for donor egg cycle, get the IVF done. It will be your baby. It's like if you require blood in an emergency, you take, quietly. So if you require somebody's egg, you take. This is professionally accepted, medically accepted modality of treatment. But ego, mujhe mera bachcha chahiye. And I have women who have come back to me 7 and 8 years later saying, Doc, if only we had listened to you. But yeah, it takes a lot.
You said a word called perimenopause. What?
Perimenopause is the period between before menopause where hormonal changes start taking place, but you haven't actually stopped menstruating.
Okay.
So it could last anywhere from 5 years to 11 years. And everybody has to identify that and deal with the problem or deal with the situation rather than shun it and say nothing is wrong.
So the female body in India to the 70s to this time, has it changed? Do you feel so?
The female body has always been the same from Adam and Eve and will go on till thy kingdom come. The knowledge of what a woman is going through, or the science behind the physiological changes that take place in a normal body has changed, or the perception of change has now come about. And in fact, my guru, Dr. Nozo Sheriar, came up with a fantastic book which is Finding Your Balance, Menopause and Beyond. It's available on Amazon and it's brilliant. It covers the entire subject from understanding the physiology, practical examples. Shanali Sabharwal has added on diets with recipes that you can deal with and accept what is natural rather than label it as a problem.
So it's a highly recommended book.
It's highly recommended.
Do you think an apple a day keeps a doctor away?
If only that was true, then we'd all be out of business. Because I truly eat an apple every day.
Okay. PCOS is a term we get to hear a lot today, but there's no end to the information available online. Can you put some light on this?
PCOS or PCOD, what does it actually mean? It's polycystic ovarian syndrome or polycystic ovarian disease. One thing, there is no cure. It is a genetic disorder. It is familial, it is inherited. It comes with a baggage of family history of diabetes.
Okay.
It is associated with hypothyroidism, acne, obesity, irregular periods, and difficulty in conception and or otherwise. It affects a woman at different stages in her life. From adolescence to menopause, the presentation is very different. The incidence in the good old days when I was studying was 1 in, I would look at 80, 90. Today in India, the incidence is 1 in 4.
Okay.
That's how high the incidence is. The criteria to diagnose polycystic ovaries have changed over the years, from the Rotterdam criteria to the AMH. A lot has changed over time and we've become more aware of it. We have a phenomenal society called as the Polycystic Ovarian Syndrome Society of India. It is run by my teacher, Dr. Durusha, and it gives you a lot of information on this problem. Most mothers say, see, she's only eating pasta, pizza and noodle. See, she's sick because she doesn't exercise. But you are the cause of a problem. You or some family is the cause of a problem. Stop blaming children. They are only doing what everybody in the peers are doing. It is not the child's fault. It is a very big genetic predisposition. So she's eating out maybe even 3 times a week. But every day, 4 times a day, she's eating what you're cooking. So what have you done to change that to help the child? The change comes in the family. You can't expect a child to follow a diet and everybody else around her is eating normal. So the treatment is nutritional. It is low carb, high protein. Change the dal, chawal, sabji, roti, ghee, butter to healthier options which are available. Make the change at the grassroots level. Hold the child's hand and say, I understand. It's okay. We will work on this together. And the child will be absolutely fine and will tide through life like nothing in the world happened.
This is an advice you're giving. Do you think people at this time in age still need to learn this?
Yes. It's a fight I fight every single day. And it is the children or the younger generation, 16, 17, 18, who then come to me even without their mothers and say, Auntie, can you please solve my problem for me because she doesn't understand. And I never blame children. Children are only a reflection of what their parents are. So let us stop blaming children. Let us start incorporating changes in our lives, and that will make a sea of change for the children. They will be more secure in their family environment. Otherwise, they want to go outside, na?
Mm-hmm. How do you deal with patients who are hesitant to talk about sexual health as simple as periods?
I go to schools.
Okay.
I started with in Powai. There is not a single school that I haven't attended for sex education. I have gone and spoken, with children from the 5th, 6th, 7th standard. I would sit on the floor with them when I could sit on the floor. Otherwise, I stand there, go into them, explain to them. The youngest PCOS for me was all of standard, I think fourth class, and she was all of some 9, 10 years of age. And you know why I got called to the school? Because she was refusing to wear a pad. The mother would put a pad for her in the morning. By short break, she'd go into the toilet, fling it out, and by long recess, her uniform would be stained. So now it was becoming embarrassing in a co-ed school. So, and the mother was called, was yelled at, was shouted. The mother started crying, "Dog, I don't know what to do." The principal, who's a dear friend of mine, said, "Anita, please come and solve this problem." I went to the school. I sat with the child and I explained to her. Luckily, she had a younger sibling. And I said, "This is Mama Pamper. And you have to wear this. Now you're no longer little baby, you're little lady." And I explained to her and I tried convincing her to wear the disposable nappy or the disposable pull-on nappy rather than wearing a sanitary pad. And all was well. She wore it, and since then I don't think I've ever heard from that family. But she obviously must be fine, because neither the school nor the mother ever came back to me again. So sometimes you have to just come down to their level to explain things to them. You can't sit on a high horse and say the child is wrong. She doesn't understand. She's already insecure. She doesn't know what to do.
So what advice do you have for parents of teenage children?
Don't forget, you were teenagers at one point. Look at what you did when you were a teenager rather than judging what your children are doing today, and stop yelling. Try and explain, try and talk. I don't believe yelling helps any cause.
Have you seen any disparity in the treatment of male and female doctors in the field?
Yes, I have. Women can be very brutal, but men are more in sync with women's thought processes, and they're kinder. And to say it all, I was delivered by a male gynecologist. Both my babies are born with nausea than going to a female. And I feel very often I have seen, which again, I'm not an authority to say because being a female myself, I'm not like that. But I've seen a lot of women who get very hyper when things go wrong. And I'd rather have somebody who's calm. In fact, I'm the calmest in an emergency situation. So whenever there was a problem at Badi Hospital, people would say, "Call Anita Soni. She'll deal with it." So I'm the happiest when there is more complicated the problem, more challenging for me.
So in our country, doctor, do you feel that the women's sexual health is being talked enough?
Sex is a taboo in this country. A lot of it is, yes. Unless we make changes, things are going to be still the way they are, especially in, say, 2-tier, 3-tier cities, maybe not so much in Bombay. Have you ever seen Vaginal Monologues, the play?
Yes.
There, at one point, Dolly Thakur said, "Say vagina." And I went for the play with a couple of my friends, and we were only 4 of us that could stand loudly and say vagina. Everybody else turned around to see who we were and how we could. It's like any other orifice in your body. So if you can't talk about what is a part of your body, and this was in a gynec conference. So if a gynecologist in a public forum is still, apprehensive or reserved about saying a particular word loud and clear, then you know how much we have to still fight.
What can be done?
Awareness. Go on, talk. Today I talk, tomorrow you talk, day after X talks, Y talks, and people start accepting. It will happen over a period of time. We are headed in that direction. It's just taking time.
So we sitting on this side as a male, what is something we as men should know about women's sexual health?
Be kind to them. Understand that it's not only about you. They may not be, they're the receptacle. They may not be in sync with you. There might be a moment where the female feels, "No, not today." Accept it. Don't shun her or punish her or force yourself on her because she said no. Maybe she's having some kind of a medical, emotional, physical problem which she's not being able to open up to you. Give her that little bit of space to be able to talk to you. Hold her hand and say, "I understand." She'll be your best friend forever.
what do men and women need to educate themselves about sexual health?
Well, be aware of what is going on. Before you have come down to who is your partner, practice safe sex. Safe sex is extremely important in today's day and age. Parents, teach your children, stop judging your children when they talk sex.
Okay.
Stop shunning them if they have a boyfriend or a partner. Teach them safe sex instead. Let the children know that they can confide in you if they have a problem. Prevention of unwanted pregnancies, prevention of unwanted sexually transmitted infections is way better, and early treatment is way better than dealing with the complications or the repercussions of untreated sexual health.
Do you think the women or the girls of today are aware of enough of their wellness?
A lot of them are, some of them aren't, but you need to go and teach them. I make it a point when anybody from any class of society comes to me, I am not judgmental if they want to have sex. I teach them on what is safe and what is protected sex for unwanted pregnancy and what is to protect themselves from unwanted vaginal infections or cervical cancers, etc., etc. It's not difficult for them to comprehend or understand. It is for us to go out and make it public and talk to people and educate them so that they then protect themselves, because eventually healthy woman is healthy family is healthy society. So the woman is the pivot of your society. Keep her healthy mentally and physically, and you see your society will be a much better place to live.
Today it's very easy for most of these young girls to feel, I'm not judging or talking about anybody, to have multiple partners. How do you look at it? Is it something which they have to be careful about
Oh, yes.
for their future?
Oh yes. Like I was telling you about cervical cancer, the commonest cause is human papillomavirus or HPV, which is the vaccine which we are all talking about. Now that is only sexually transmitted. You can't pick it up from the air. It's not a virus which you can pick up while talking to somebody or from using public toilets. It is a virus which is transmitted sexually. So unprotected sex or sex without a condom predisposes to developing HPV infection, which may later on convert into cervical cancer. So how do you protect yourself? Use a condom. How many men are willing to use a condom for safe sex for themselves as well as the women? And how many women understand that even if you have multiple sexual partners, if you use a condom, you're only protecting yourself.
But you feel using a condom also still can affect a person, a girl with multiple partners?
If you are, again, like I said, preventing from unwanted pregnancies, protection against unnecessary infections, yes, will prevent problems. We don't promote polygamous relationships. I'm very much for a monogamous relationship. But if for whatever reason she's in a situation which so demands it, you have to keep counseling her. You don't promote it and say, use a condom and you'll be fine. But if she's there, you have to be able to give her some kind of an option, because when she's going through it with that one partner, she feels that he's for life. But she doesn't have to get stranded with him if he is not matching the vibe that she would want.
Let's talk about life-work balance of a woman in this country.
I don't think I ever had that, but I'm trying. I'm trying very hard. I promised myself that I'm going to try and get a balance somewhere. When you're young now, you have EMIs to pay, you have loans, you have children to educate, you're not as financially secure. So that I'm saying life work balance and all is very nice in textbooks, but when it comes to brass tacks, it's very difficult. As you grow older, things kind of settle down, but you're always chasing a rainbow.
Okay.
So I decided for myself that time has come to take one step back, focus on my family, which I did not in my younger days. I am trying to be there for my children. I'm trying to be their best friend rather than being only a mother to them. I'm not going to be only a provider. I want to be the safe space that they feel they can come to me and talk about anything in the world, and I will help them. I won't judge them. I want to be a perfect partner to my husband, who's been rock solid support and has never really judged me for who I am. But I know I haven't been there the longest because it was always my patient, my hospital, my work that came first, and then my family. So I'm trying to do that. I hope I am able to before the good Lord says, Chalo, it's time.
We have a long way to go and get
Not
this
really.
world better. And so, tell me one thing, doctor. This is one part of society where we are looking at. People are listening to a podcast who are in a certain strata of society, जो अंग्रेजी समझते हैं. But then there are different parts of the society where you go to schools, as you said, you talk about sex education and all that. So how do those parents kind of cope up, and which is the right age to introduce sex education to a child? And there are two questions in this. So how do you kind of talk about sex education, well-being, being a friend to the child in a certain strata of society?
Okay, I'll start with your first question, which is when is the right time for introducing the subject to a child? Before she attains menarche or before she starts menstruating, she should be aware of it. Otherwise, she's in shock. Somewhere she's got hurt and she can see blood. It's not fair. Today, the average age is between 10 and 12. So you might feel that the child is too young, but I feel start talking about female anatomy, not sex. Female anatomy, male anatomy, make them aware of what their genitalia are.
Doctor, I'll just cut you a little bit on this. The common misconception today is that today's kids are getting their periods a little earlier than the early one. Is that so?
Of course,
What is the reason?
it is just your affluence, your lifestyle, PCOS, your genetics, everything. In the good old days, I'm telling you, 13 and 14 was considered normal. Today, 9 and 10 are coming with periods. They are not abnormal, it's just their early menarche. So you have to be very careful. That is why you gingerly tread that talk. You introduce female anatomy. So what we do is we have boys and girls separate. I take the girls, the surgeons or the males take the boys, teach them plain anatomy, very simply. Then introduce what is period, don't feel you're abnormal if you get, teach them about breast development, about hair development, and this happens over standard 5, 6 and 7. By the time they've come standard 8 and 9, I go and talk to them on sex education, safe sex, condom use, oral contraceptives, polycystic ovaries, and maybe 9th and 10th if at all required, mothercraft. And you will be surprised. I did my basic education from Auxilium and then JB Vacha. In JB Vacha, which I'm very proud to say, we were taught all of this. This is 1980s. So many years ago, these were the subjects that we were taught in school also.
Still it is there.
Yes.
Is it getting better?
Oh, it is phenomenal. Those are schools which were open, which would talk about it. Certain schools don't talk so much, but thankfully in Powai and the place where we live, they invite us and we go and have talks and we kind of educate the kids about all of
My
this.
question earlier, which was about the lower income group of society, those schools, how do you reach out to? What should be done?
They should also encourage, talk, but now municipal schools and stuff, I went through Rotary, I went through, the social organizations where I went and distributed sanitary pads to those girls. They used to use cloth in today's day and age. Still, which is so unheard of.
What can be done about it?
Help them. Provide for them. Sanitary pads are so cheap. Please help sponsor. Please help the low socioeconomic strata realize that this is not something only for the affluent. It is just menstrual health. And it is a necessity for everyone. And it's a birthright of every woman.
Can the country do something about
And the country is doing something. Haven't you seen Akshay Kumar's advertisement
Yes,
in theatres where they say cigarette itne ka aata hai or sanitary pad itne ka aata hai, to Mavarik health is very important. So the country is doing. Ever since the governments have been working towards it, there has been a sea of change. I will not take it away from anyone.
Wonderful. You've been a doctor for so many years, Dr. Anita Soni. Tell us some funny interactions with the patients who are misinformed, women and men.
Well, everybody thinks, people are very judgmental.
Okay.
Anita Soni is as much a human being as you, her, or anybody else, right? I have my days, which I have had good days, I've had bad days. I also get tired, I also get stressed. So treat me like an ordinary human being. But otherwise, I'm a temperamentally very fun-loving human being. I'm always the center of a party. I love to dance.
You go to a party and the dance starts, that's what I'm saying.
Exactly.
So that kind of goes on to your work also?
Oh yes. I'm even in hospital where when I step in, I'm the noisemaker. I will start some little bit of fun time because I believe, work will go on, life will go on. You've got to enjoy it all. So my way of dealing with my own life is between patients, you'll see me step out of my OPD. There'll be a lot of people around. I will see a lot of people I know over the years. I'll go up to them and say, hello. I have a thing with names. I remember most people. So they're surprised. Doc, you still remember me? And I said, अरे यार जो यहाँ से काम करता है भूलता थोड़ी ना है. So they feel connected and I feel very happy with that. My hospital, my work is my go-to. It's my relaxation.
Any incident which you tell me about where it's a funny incident where you feel that person doesn't know anything about sexual health and there's been some chaos or whatever, like any kind of incident you feel? Because I heard of the ladies on the delivery table screaming, shouting, abusing the doctors. This all happens, isn't it?
Well, here in Nandani Hospital had a Diwali party at Westin and we were all supposed to go there for lunch and everybody kept calling me, where in the world are you? Why are you not here at this lunch? And there was this lady who was an IVF pregnancy, very, very precious, and she was in labor and I had to deliver her and I kept sitting with her. She came to me the other day and incidentally she thought she was breastfeeding and okay, I delivered her that story and she had a normal baby and all and she was breastfeeding and as usual she didn't get her period and like most women never realize that they need contraception even when they are breastfeeding. She comes to be pregnant again and this time now she says, I won't ruin your September party like I'm planning something in September. And I said, I don't care. You make sure last time you ruined my Diwali party, this time you're not going to ruin my September party. So please, I will induce you, I will deliver you. But not on that day. So it's like, it's a fun event for me. It's not something that I run away from. I have come, like Ganesh Chaturthi in my house, if anybody comes in, knows that if I have disappeared, I'll go deliver the baby and I will come back. And everybody says, how the hell can you do it? People say, don't touch knife, don't touch scissor when Ganpati is at home. I said, that's my bread and butter, that's my life. Just because Ganeshji is in the house doesn't mean I'm not going to do my work. And if babies have to be born, so be it.
Doctor, two important questions to you. One is, how do you deal with criticism? Because I think a doctor most times is highly misunderstood by some people and they kind of get back at you, they trouble you, they pain you. But you're just doing a job as a human being also. How have you tackled those things?
Like there have been times where social media has abused me. And I broke down. I really broke down. There were a group of people that were dead against me. But thankfully for me, there was this big group of people, my friends, who stood by me and said, you just continue doing what you're doing, you will never have a problem. I changed over time. There was a time while in a hospital I was called to the boardroom and said, go see your Google review. I didn't even know what Google review meant. And I had some 2 And one of my friends took it upon herself, made something and sent it to a lot of my contact list. And overnight, in 48 hours, I went up to 4.2. And I said, I can't be that bad, no? I have never asked anyone for any review. I have never asked anyone for anything. And I didn't realize these things are so important in today's day and age. People go and check your review and then come to you. And somewhere I told the management, let them come for me as a human being and not what social media has to say about me. If they come to me and still choose to come to me, I will take that as a plus. And if they choose to come to me and are unhappy with who I am, I will take that as a double plus, because they have had the intention of coming to me. I will take it because I tell everyone that if you're not comfortable, get a second opinion. I'm okay with it. Don't worry, I will not judge you. I will still treat you for who you are. And if you feel like coming back, you're more than welcome. So again, don't feel bad. And after 10 and 12 years, there are patients who had judged me 12 and 15 years ago who have come back to me even now and are doing much better, and I have been able to solve their problems. And I am so happy that those people have finally understood who I am. So it has been a sea of change. I guess I also changed. Like everybody said, menopause causes brain, fog and disturbances. I think I calmed down as a human being, and I matured as a human being, or people just started understanding me better.
Would you like to talk about surrogacy?
Surrogacy was my baby. I never started surrogacy in the country. So, contrary to what most people believe, but me with Dr. Naina Patel from Gujarat, we were the largest people, or the largest number of babies born of surrogacy was from us, because I was a proper referral center to most IVF clinics in Bombay City, barring one or two, and we had very, very good results. Unfortunately, few people exploited the rule, and for not, for things like body and shape, etc., they opted for surrogacy rather than, and the government kind of banned it. But now the rules are becoming a little more liberal, and people that require surrogacy, it's a brilliant modality. Please understand, when you need blood, you take blood. Mm-hmm. When you need an organ, you take an organ. Mm-hmm. When every woman having a baby is her birthright, support her. Na? Why judge her? There are women who are born minus uteri. There are women who have gone through so many medical problems. There are people who are dying to have a baby and cannot. Surrogacy was an option for them. And funnily, I was the doctor for the poor patient, the surrogate. I was never the doctor for the people who needed surrogacy. So I was not from that end, which was, you could judge me about money making or any one of these. But those people also, I have had women who earned to be able to treat her child from a spinal disorder. I have seen women who were being hammered by their husbands who were alcoholics, and now they had homes of their own. They were financially made independent from the point that because they earned a little bit of money. To our class of people, couple of lakhs means nothing. To the low socioeconomic strata, those couple of lakhs gave them a new vista in life. So it was a win-win for everyone. I hope at some point, with stringent rules, that people start accepting surrogacy again. It is there to stay. It will come back.
It will come back?
I am sure.
That's great. I hope it will help a lot of people also.
Exactly. Don't look at it as a money-making gimmick. Look at it as a medical option for people who truly need it.
Wow. Few lines of advice for would-to-be parents, the young generation, and what probably the country has to inform people about sexual health.
Well, I'll start with the younger generation. Understand, sex is an animal instinct.
Okay.
It is going to go on forever.
We are born with it.
We are born with it, we go to our graves. Yeah. Please read about it, but believe in safe sex. Because nobody matters to you as much as you do. I, me, myself, have to look after I, me, myself. You have to learn that. Say it to yourself 10 times. Sex will come, sex will go. The urge will always be there. But don't fall prey to it. Don't abuse it. Safe sex, extremely important. Don't run away. In case you've made a mistake, please consult a doctor. Don't run away from problems. To parents, please support your children. Don't stand judgmental. Yes, forgiveness, it plays a very big role, but somewhere something is incomplete in their life now, where they have to go elsewhere rather than looking for happiness within this framework of family. Try and be there for the family. Once a woman is brought into your house, she has left her home to come to yours.
Right.
She's trying to be accommodating, adjusting in your family, but she has a life of her own. She has been brought up for 25 years by her parents in a particular way, with a particular eating habit, with a particular dress sense. Accept her for who she is. Don't judge her. Yes, ask her to amalgamate in your society. Don't judge her because she's different from what you perceive as normal. When she's going through reproduction, hold her hand. It is a sea of emotional and physical changes that she's going through. Help her, walk the talk for her, because she's a part of your life. Hindu tradition calls her Ardhangini. What does it mean? She's half of you. Accept her, hold her, love her for who she is. When the baby comes, it is not only the woman's responsibility. Is as much a man's responsibility or the husband's responsibility or the father's responsibility as it is the woman's. You be the barrier between the rest of the world and her and the baby as a unit. That is your family. Everything else is extrapolated. Protect her. There will be tradition, there will be things. Learn to accept, adjust. Don't say this is how it is and this is how it needs to get done. Understand her perspective too. As they grow older, a lot of women go through a lot of disappointment in life because now the children are growing up, they are flying the nest, empty nester syndromes. They spend the larger part of their life looking after the husband, looking after the in-laws, looking after the children. Suddenly they find a void in their family. They find a void in their life. Try and encourage, go, hold her, take her around, help her pursue a hobby if nothing else. Let her pursue a career if she's interested. Be supportive to her because understand that she's suddenly finding herself at loose end. And when she's going through hormonal changes in perimenopause or menopause, understand that. Don't force yourself on her. There will be days where the vagina burns. I have patients telling me it's like mirchi powder in my vagina. Doc, I can't handle it. Understand, help. Use a lot of foreplay. It's not only you. It's both of you need to be in sync with each other to enjoy it. And as time goes on, be that partner that will walk with her. Hold her hand, walk the talk, be there for each other till time immemorial.
Wow. The bubbly, magical Dr. Anita Soni on Who's On Air. Doctor, this is probably just one episode with you. We look forward to more because you have so much of information, so much of things to give to the society. We need more doctors like you, and you will definitely touch more lives from here on. Thank you so much for being on the show.
Thank you, Kamlksh, for inviting me. You know I'd do anything for Lopa, you and the kids. So at any point in time, if you feel like you want even a stopgap or you want a filler, I am more than ready to come back on. Not for anything else because you guys are awesome.
This is just part one, I said. So
I will come back. I will come back.
Thank you.
Pleasure's all mine.
Thank you.